So hello, everybody. Welcome to the Healthcare Reimbursement Program's informational session.
Marche, I'm sorry, I muted you on accident. Could you unmute? Thanks.
All right. Hello there. All right. So again, my name is Marche Jones. I'm the director of CCPU operations. And we're going to go ahead and get started. I want to welcome everybody today to the Healthcare Reimbursement Program informational. And to kick this off, I'm going to begin by turning it over to Alex, who is going to be our Spanish interpreter. He's going to go ahead and provide the instructions for everyone to ensure that we all get into the right language room.
Thank you, Marche. Good afternoon, everyone. We're offering live interpretation in Spanish during this meeting. If you wish to hear Spanish interpretation, please click the interpretation button at the bottom right of your Zoom screen. If you're joining via the Zoom smartphone app, select the language by clicking More or the three dots in the bottom right corner of your screen. You will select the language interpretation, and then you can choose Spanish, or in such a case, the English speakers will choose English. Then you will click Done. If you wish to hear only the interpreters and not the original speakers, be sure to click Mute Original Audio. Buenas tardes, estamos ofreciendo interpretación en vivo en español durante esta reunión. Si desea escuchar la interpretación en español, haga clic en el botón Interpretation, que significa interpretación, en la parte inferior derecha de la pantalla Zoom, y verá un icono de un globo terráqueo, un mundo. Si se está uniendo a través de la aplicación Zoom para smartphone, seleccione su idioma haciendo clic en More o Más, o en los tres puntos en la esquina inferior derecha de la pantalla. Seleccione Language Interpretation, que es interpretación del idioma. Después elija Spanish y haga clic en Done, que es listo. Si desea escuchar solo a los intérpretes y no a los oradores originales, asegúrese de hacer clic en Mute Original Audio. Todos deben elegir un idioma, no se quede en la posición de apagado predeterminada. Everyone has to choose the language of their preference. Thank you.
All right, so Connie, we're ready for you to assign Alex as interpreter.
Okay, Alex should be assigned.
All right, just giving everybody a few moments to pop into the correct room. All right, so before we get started, I'm going to go ahead and turn it over to Paloma. She actually has a very important bargaining update, and she is a longtime member of the bargaining committee, and she has information that she would like to provide to you all. So Paloma?
Thank you so much. Hi, everyone. My name is Paloma Corona. I'm a family childcare provider from Los Angeles, and I'm also a proud member of our union and a member of our CCPU bargaining team. I'm here with fellow providers to share the latest update on our bargaining efforts. Our CCPU bargaining team met with the state over Zoom to continue bargaining our next contract. However, last month, we submitted a proposal to the state aimed at helping providers in fire-affected areas recover, rebuild, and achieve stability, enabling them to continue serving families. We are demanding that the state maintain financial support for affected providers who cannot return to normal operations within 30 days, a protection that ends this week. I believe it's going to be ended today or tomorrow. Not all providers are yet able to reopen. This proposal includes ongoing payments to affected providers and addresses various extraordinary disaster-related expenses, such as deep cleaning, managing smoke and ash, conducting repairs, replacing equipment and materials, securing new facilities, and providing technical support and mental health resources for recovery. We also call for investments in climate disaster resilience to be better equipped providers for future emergencies. This support is essential for us to maintain our ability to care for families and children throughout Los Angeles and across all California. But of course, once again, the state has only delivered more delays. We will not back down. We will continue to urge the state to take immediate action on our proposals. So here we're asking you to please join us in this action. We will not allow the state to keep disregarding our essential work, and we must be ready to fight for what providers need. The wildfires in Los Angeles, along with past and future disasters, have highlighted the critical need to implement our cost of care proposal. All providers need to make our voices heard and demand immediate action from the state. Here is what you can do. Click on the link that Danielle is going to share in the chat to make a call to Governor Gavin Newsom and let him know that it is time to act. Let's do it. I hope you all join the fight and call Governor Newsom. Act on extending the 30-day payments and other fire demands so providers can continue to serve families in LA, as well as immediately respond to our cost of care proposal. This call takes less than 2 minutes. I'm pretty sure that we're very, very busy, but we will have 2 minutes. We will make sure to have those 2 minutes to make the call. And all you need to do is follow the steps after you click on the link. The form includes a short script to follow, but it is very important you make your call during the regular business hours, Monday through Friday, 8 a.m. to 5 p.m. Right now, it's the perfect time. It's nap time. We have a little bit of flexibility right now. So, well, maybe not right now, but after the meeting. So please, I urge you to please join us, make the call, and make sure that if you know more people around you, have them all call the Governor Newsom so we can have the action that we need. Thank you.
All right. Thank you very much, Paloma. Okay, so for all of you who are joining today, hopefully you're in the right meeting. We're going to actually go ahead and talk about the Child Care Providers United Healthcare Reimbursement Fund. Here is our agenda for today. So we're going to do a quick program overview. We'll talk about who is eligible. We'll also talk about some reimbursement program benefits, right? I'm sure you all are interested to know exactly what an enrollment in this program will actually get you. We'll talk about that. We'll also go over a really exciting new topic, which is some additional benefits that this program is offering. We'll talk a little bit about health plan enrollment assistance for our providers out there who may need some help either enrolling into a plan or into the correct plan. And then we'll circle back in the end about using reimbursement program benefits and ways in which you can do that. Hopefully at the very end, we may have time for questions. And if so, we'll try to answer as many as we can. But I do want to put out the disclaimer that typically in our virtual sessions, we do not want to get too deep in the weeds on personal questions because we don't want to air your business to the masses. So I'll caution you to just hold all your questions until the end or to put them in the chat, and hopefully we'll circle back and get to those. All right, so let's kick off our program overview. So what is the CCPU Healthcare Fund Reimbursement Plan? So a little bit of history, right? So the healthcare trust that we have is actually governed by a board of trustees What's really great is that the Board of Trustees is made up of childcare providers like yourselves and members of your local unions. So the trustees are appointed from the 3 unions that are represented for the state of California, and that's Local 521, Local 99, and UDW. So the gist of why this was all set up and put together was that it establishes a fund that is specifically designed to help providers pay for and afford medical insurance and medical care. It will reduce or eliminate out-of-pocket healthcare expenses and help providers actually pay for copays, deductibles, and any other type of expenses, including your monthly premiums. But how did we get here? So those 3 unions that we mentioned before, they actually came together and they fought in order to get Governor Gavin Newsom to award $100 million that's funded by the state of California. That's a direct result of collective bargaining by Child Care Providers United. And again, the money is for the sole purpose of child care providers like yourselves to be reimbursed for or to pay for eligible medical expenses. So what I like to highlight during this section is that the money that is being awarded for this program is specifically for child care providers, right? So it's not for your local grocery store clerk. It's not for your local police officers. It's not for your teachers, right? It's literally specifically for you. So you want to take advantage of this benefit because no one else can. It's only you. All right, so before we kind of continue down the path of what this program is, I want to just establish some ground rules on what it is not. So this program is not a health plan. What it is it's here to reimburse you for your eligible expenses that you may incur with your health plan. So in other words, it's not an insurance. It is not designed to replace your insurance. But what it is designed to do is to partner with your healthcare insurance and pick up any out-of-pocket costs that you may have so that it's affordable and in most cases, zero cost to you. So let's talk about who is actually eligible. All right. So this may seem too good to be true, but there are only 3 pieces of criteria in order to be eligible for this program, right? So the first of that is that you have to be paid for working with a state subsidized child. You have to be enrolled in a qualified health plan, and we'll talk about what those are in just a moment. And the last criteria is sort of a no-brainer, which is you just have to do an application. So only 3 things needed to take part in this program, and you can partake in the benefits that it offers. So let's talk a little bit more about criterion number 1. So paid for working with a state subsidized child. So a subsidized child is essentially a family receives government-sponsored financial assistance to help pay for their child care. And a provider's child care is then reimbursed through a government assistance program. So if you are a provider that actually has children on your roster or your care roster, and you're receiving payments that are subsidized by the state, you've already satisfied criteria number 1. It's also very important to highlight that you have to be subsidized by a state program. So if you think about it, this program is actually funded by the state, right? That $100 million is coming from the state of California. So they want to be sure that the programs that are subsidized for children and that you're being paid for are also state funded. So if you're being paid by a federally funded program or a city program, those won't qualify you. It has to be a state subsidized child. All right, and so the other really cool thing about this program is that because it has a board of trustees that are made up of childcare providers like yourselves, they are aware, right, that as childcare providers, your roster of children, it kind of ebbs and flows, right? So you may start out with kids for, the first half of the year, and by the time you get to the end of the year, you may have a completely new roster or different roster of children. So what they did is they established what we call initial eligibility and continued eligibility rules that run off what we call a look back period. So essentially, they wanted to make sure that in the event that providers have a change in having subsidized children throughout the year, it was not an automatic dismissal of that provider being eligible for benefits. So here's how it works. What happens is whatever quarter that you apply in, this program will look back for the prior 6 months and see if you actually had payments for the care of a subsidized child. As long as you have payments for 3 out of 6 of those months, you qualify for initial eligibility. And then in order to continue your eligibility every quarter of the year, because we do quarterly eligibility, you only have to maintain having a state subsidized payment issued to you for 1 out of 3 months going forward. And I know what you're all thinking, you know, well, Marche, what happens if I go 6 months, right, and I don't pick up another state subsidized child? That's okay. So this program, again, your board is made up of providers like you. They understand how this goes. So they will grant you what we call a grace period. So if you're a provider who goes, let's say 6 months without state subsidized children, you can be granted a grace period for one of those quarters. All right. Criteria number 2, you have to be enrolled in a qualified health plan. So again, because the idea is to ensure that we can cover and support as many child care providers as possible, the list of the list of qualified health plans that we accept is exhaustive, right? So we have quite a few plans that we accept. So the first one that you'll see on the list is a Covered California Silver HMO plan. That is the plan that we require providers to be enrolled on if they are enrolled with Covered California. We'll talk in a minute about why it's a Silver HMO. I want to also kind of just put a star by this because there are some areas in California where HMOs are just not offered. In those areas, if a provider is enrolled on a Silver EPO or PPO, we will also take those, but it's only if there's no HMO available. Also, if you are a provider who is currently undocumented and you're not currently eligible to enroll with Covered California and don't have any other health insurance, you are able to go carrier direct. You just have to enroll on a Silver level HMO product. Medicare and Medicare Advantage plans are accepted. If you're enrolled with a spouse or you're a dependent, or you have another job and you have employer-sponsored coverage, that also qualifies for our program as an eligible plan. Medi-Cal, if you're a provider who's on Medi-Medi, meaning you have both Medicare and Medi-Cal dual, we accept that as well. And then any Veterans Affairs healthcare benefits, we also accept. And then the last would be TRICARE. We also accept TRICARE. In a second, we'll talk about the support that we also have for any providers who, you know, might be uninsured. We'll talk about that also in just a moment. All right. So one of the more important things about your qualified health plan or criteria number 2 is that having the health plan is not enough. You have to actually show it to me, right? So if you're a provider who's signing up for this program and you're like, okay, Marche, I satisfy criteria number 1, I have subsidized children on my roster, and I satisfy criteria number 2, I absolutely have one of those health plans. Now you got to show me documentation so that I can verify that. I want to talk really quickly about acceptable documentation and really ensuring that your qualified health plan documents are acceptable. So what you want to do is gather a document that shows that you're enrolled in a health plan, right? And it has to have 4 things. So the first is obviously it has to have your name associated with the document so that I can associate the plan with you, right? So we just need to know that this document is associated with you. The second thing that it has to have is the effective date of the plan. This is very important because the effective date is going to help me know when to start helping you pay your premium. Very important, has to have your effective date. All right, criteria number 3 for being acceptable, an acceptable document. I need to know the name of and the type of plan you have, right? So because we have that list of plans that we accept, they all have different benefits. So in order for me to make sure that I give you the right benefits, I got to know what kind of plan you have, right? So you want to make sure that your document outlines for me what you have, whether it be Medi-Cal, Medicare, a covered California silver level HMO, etc. You just want to make sure that that's noted. And then the last thing, which I think is one of the most important things, is if you're paying a premium for your insurance, I need you to tell me, because if you don't tell me, then I can't give you the money to help you pay the premium. So you want to make sure that if you're paying a premium for your health insurance, that you also provide your premium amount on that document. All right, and then number 3, remember 3 things to get into this program. The third thing is just do an application. So by doing an application, it's really simple, everybody. If you have not already done it, highly recommend you visit our website at ccpuhealth.org and actually go ahead and fill it out via the web or download an application and send that in to us. Essentially, all it's going to ask you for is your contact, pretty much information, who you are, what's your address, what's your phone number and email. It's going to ask you a couple of demographic questions and about your affiliation with the unions. And also, it's going to obviously ask you about your health plan and then to provide proof of that health plan. You sign the bottom, you send that back to us. And as long as you ensure that that document that you're submitting with your application has those 4 things that we just talked about, you're as good as gold in terms of getting into our program. Okay, so we've talked about who's eligible for the program. Probably the most exciting part of this is, well, what does it get me if I actually get into this program? So remember, I kind of told you a few moments ago that one of the things that's important about your documentation is what plan you have. So because we offer and accept so many plans for this program, all of our benefits, right, are predicated essentially on what plan you have, right? So if you have a silver level HMO through Covered California, I'm going to give you $9,450 to pay for your out-of-pocket costs for the year. And I'm also going to reimburse you or pay your provider portion of the premium. So in a scenario, if you're on a silver level HMO by yourself, I'm going to pay your entire premium. You're going to have 0 out-of-pocket costs for your health plan. If you're in a scenario where you're enrolled in a silver level HMO plan with Covered California with your family, I'm going to pay your provider portion of the premium, and then you would still then be responsible for the remaining premium amount associated with your family members. The calculation is something that my team will help you with. So if that's your situation, that works out. Send it in to us. If you are on a silver level equivalent and you are not through Covered California because you're undocumented, I'm going to give you that same $9,450 and $100 towards your monthly premium. If you are on an employer-sponsored plan, right, either as an employee, the spouse of an employee, or dependent of the employee, I'm going to give you that same $9,450 for the year for all of your out-of-pocket costs, and then an additional $200 per month to help pay towards your employer-sponsored health plan coverage. If you are a provider who has Medi-Cal, right? So Medi-Cal is a bit of a unicorn because it typically is either 0 cost to those enrolled on it, or it has very little cost. Well, we don't want to leave those providers out. So Medi-Cal, I'm going to give you $200 per month. on a debit card in order to spend on what we call permissible expenses. So permissible expenses are definitely different than the out-of-pocket expense of the plans above it, in which we can actually help pay for, things like over-the-counter medication at your local drugstore pharmacy, right? I need cough syrup, I need cough drops, I need Tylenol, right? That $200 for Medi-Cal participants can be used towards expenses like that. All right, if you have Medicare or Medicare Advantage, I'm gonna again give you $9,450 per year for your out-of-pocket expenses, and then up to $185 a month to pay for your Part B insurance. And if you have that Part D insurance on top of that, right, that pharmacy component, I'll also pay up to $100 per month for your pharmacy premium. All right, and then if you are a provider on dual Medi-Cal and Medicare, so what we call Medi-Medi, again, $9,450 for your out-of-pocket expenses, up to $200 per month for permissible expenses, right? So you kind of get a hybrid of Medi-Cal and Medicare, in that you get permissible and out-of-pocket. All right. Coming up almost last but not least is Veterans Affairs healthcare benefits. Typically, there's no premium associated. So for this plan, we will still provide you that $9,450 for out-of-pocket expenses. And then last are our TRICARE plans. If you have TRICARE Prime, Select, Reserve Select, or Retired Reserve, we'll provide you again the $9,450 per year for out-of-pocket expenses and $100 per month for premium expenses. And if you are lastly TRICARE for Life, we will reimburse your Medicare Part B up to $185 per month. All right, so I want to touch upon really fast what some of you may be wondering, which is why is Silver Level HMO? Silver level plans through Covered California are always the most cost-efficient plans on the market. They maximize the cost assistance available through their APTC program, right, and cost sharing program with Covered California. And it basically ensures that the money that this program provides for your premiums and your out-of-pocket is essentially maximized so that you have either no cost or very, very low cost. All right. It essentially is going to allow us to provide the best possible benefits to the majority of the folks. All right. So there are some instances, right, where I either have providers who need either assistance changing their plan, right? You might look at the list and say, ooh, Marche, I have a Covered California plan, but it's gold, and you're telling me I need a silver. I'm on the wrong plan. You have to switch a plan, right? Any provider who either has to switch a plan with Covered California or enroll in the correct plan with Covered California. If you need assistance making your initial binder payment for that new plan, I will also help you pay it. So if you actually make the switch, in order to actually get the coverage started so that I can get you in my program, you just have to let me know, send me confirmation that you made the switch, and I will contact that healthcare plan that you selected and pay your initial premium. So again, being in the incorrect plan should not be a barrier to benefits. We're going to make sure that we can actually get you where you need to be in order to take advantage of this program. All right. Lastly, we may have some providers that just plain old don't have health insurance, right? And we see this every day, and that's okay. This is also not a barrier to benefits. If you are a provider out there that currently does not have a health plan that you're enrolled with, we're here to actually help facilitate you actually getting that healthcare coverage. So you can contact us directly and advise us of that, and we'll actually help partner you with an enrollment professional that'll actually get you enrolled in a health plan. Or if you want to be proactive, you can also visit our website at ccpuhealth.org/help-enrolling. So our website has these 7 brokers and partners listed for Covered California enrollment assistance. You'll see that they all have different languages that they support. So you can absolutely select the one of your choosing if language is a factor. If you're a provider who was within Medicare age, right, and you need assistance with enrolling into a plan with Medicare, we also have these 5 brokers on our website that will have partnered with us to do that as well. And then lastly, if you're a provider who thinks you may qualify for Medi-Cal, down there in the bottom in that purple bar, there is a hyperlink that's also on our website that will help guide you to your local county office to actually get your enrollment kicked off. All right, so probably the most highly anticipated section of the presentation, which is additional benefits. So currently, we have a lot of change happening for the Healthcare Reimbursement Fund. The trustees are hard at work making additions to the benefits that we offer in order to really make this program the best version that it can be for you childcare providers. So let's talk a little bit about what you get in addition if you enroll in the Healthcare Reimbursement Fund. So beginning last July, so effective July 1st, if you enroll with us through the Healthcare Reimbursement Fund, we are also going to give you dental and vision coverage free of charge. So currently we're partnered with MetLife, and they are actually providing our dental and vision plan benefits to our childcare providers enrolled through the healthcare fund. So what that means is that providers don't need to do anything in addition to get this benefit. As long as you apply with me for the healthcare fund and you get approved, I'm also going to enroll you in dental and vision with MetLife, and they're going to send you your enrollment information to actually be able to see a dentist and or an optometrist or ophthalmologist for your eye care needs. There is no separate application, so there's nothing extra that you have to do. Also very important to note is that you cannot enroll in dental and vision separate from the reimbursement plan. So if you're interested in, saying, hey, I really need to go see a dentist, or, man, I need a new pair of glasses, get into the program so I can get you these benefits free of charge. And then the last thing is you'll see the website at the bottom, metlife.com/info/CCPU. Please visit that website. It's dedicated for providers to give you additional information about what MetLife is offering and what services that you can actually have done. All right. Also very important is if you are enrolled already with our healthcare reimbursement fund and you have your dental coverage with MetLife and you're in an HMO product, very important that once you get that up and running, you visit the MetLife website and you go to find a dentist and assign yourself a dentist. It's part of what all providers need to do for their dental coverage once it's active. So again, visiting metlife.com and going to that find a dentist and then next to how we help you. All right, once you do that, you're going to select dental HMO/managed care or PDP if you're in a PPO product in order to choose your network. And then a list of participating dentists in your area will populate and you're free to select a dentist of your choosing. All right, so let me tell you about additional benefits that are actually in progress right now and coming soon. This is hot off the press. You guys are the first people that are going to hear me talk about this. One of the benefits that's in process of being added to this program is group term life insurance. So we're currently in the process of building and adding that to our benefit portfolio for the Healthcare Reimbursement Fund. It will be effective 1/1/2025, so it will be retroactively effective. It is at no cost to the provider. and you will be automatically enrolled into this benefit when you're approved for the healthcare reimbursement program. The amount that you're getting is obviously gonna be dependent upon age. So I don't have any of the specifics to tell you today. But what I will say is that if you are not enrolled in the healthcare reimbursement program, you should do so at your earliest convenience. The next benefit that we're also in the process of adding, which is highly anticipated, is the retiree health benefits. So it's important that you remember the nuance, which is retiree and health. So this is not a retirement plan. It is not the same as the retirement fund. It is specifically a bucket of money that will be set aside for childcare providers so that once you retire from childcare, you'll have a little pot of money to help you pay for any of your expenses in retirement. Here's the catch. In order to get a piece of this retiree health benefit pie, you have to apply into my program by 3/31/2025, and you have to be eligible for coverage beginning Q1 of 2025. Uh-oh, looks like someone's drawing on the screen. Maria Liao. All right, so let me say that one more time because this is the biggie. In order to get a piece of this retiree health benefit pie, if you are not already in the program and active, I need you to apply before 3/31 and for approval for Q1 of 2025. This benefit will be here to help pay for any medical cost in retirement, and again, is at no cost to the provider. It's being provided free of charge. All right, and then our last set of additional benefits that are coming soon are the healthcare reimbursement benefits for family. So this is a big ticket item. There have been quite a few providers who have asked about this over the last few years, and here it is. The healthcare reimbursement benefits for family is an expansion of the current reimbursement program to help cover expenses for eligible spouse and/or children. This again is at no additional cost to providers. Depending on your family makeup, it will dictate the level of benefits that will add to your benefit allotment, and it'll be for your family and for you. All right, the next thing coming, there's two more left, everybody. Voluntary life insurance. So let's say that, you get your regular group term life that I talked about before, and you say, you know what, Marche, perfect, but I think I want a little bit more life insurance. We are going to have the option for providers to do two things. One, you can say, hey, I want some additional life insurance on myself, and you'll have the ability to actually sign up for that and to actually purchase out of your own pocket additional life insurance on top of what we're offering you at no cost. Or I should say, if you wish to purchase life insurance for your spouse or for any of your dependents in your family, you're also able to do that at a cost. So that's on its way to being added to your benefits for this program. And then the last but not least are EAP benefits, which will be, again, at no cost to the providers and assist with provider mental health and substance abuse assistance if needed. And I'm gonna really quick stop sharing and reshare everybody, because I know that there was the drawing on the on the screen. All right, here we go. All right, almost to the end, everybody. Hang with me. All right, so the last sort of piece of this program is, Marche, you've told me how we got here, you've told me who's eligible, you've told me what I get if I'm approved, and all these really cool additional benefits that are coming. The next question is probably, well, how do I use it? Like, how do I actually access these benefits once I get approved and I'm in your program? So let's really quick talk about using the reimbursement program benefits. So you have some options, okay? So if you are a provider who gets enrolled into the reimbursement program and you're on your way, you have a few options in order to actually access those benefits. The first and probably the most popular way is through a debit card that we will issue to you with the money that you're owed on it, right? So if you're a provider who is, for instance, Cover California, and you have a premium that you're paying and you have your out of pocket, so you have that $9,450, you will have access to a debit card to swipe at your doctor's office for your co-pays, at your pharmacy to pick up your prescriptions, at your lab to do your lab work, right? We'll provide you that debit card in order to use it for those purposes. We have some providers, believe it or not, that would rather pay out of pocket, right? They're like, not really feeling the debit card, right? I kind of prefer to use my own money. And then that's also an option, right? So if you're a provider who prefers to pay out of pocket, what you'll do is pay using your own funds. You can send us an email with a copy of the receipt showing you paid something, and we'll actually just send you a reimbursement for the monies that you spent. So any out-of-pocket costs that you actually spend out of your own money, we'll reimburse you via check or money order. All right, and then one option that's on here that that's not on here that we don't talk about enough, there's actually a third option, which is the option of having us pay for a service on your behalf. So let's say you go to a doctor, you have services done, you swipe your card, pay your copay, and then you go home. And then, a week later, you get a letter in the mail from the doctor saying, hey, you still owe us this. Here's your invoice for the rest of what you owe us. Happens all the time, right? Instead of you going back up to that office and swiping the card or mailing them a check out of your own pocket, you can actually send me that invoice and I will mail a check to that doctor on your behalf. So you also have that option and that flexibility in terms of using and accessing your benefits. All right, so since we're mentioning debit card, really important that we go over some debit card 101, right? So the first thing is that once you get approved, I'll mail you a debit card and stick that in the mail, and you'll receive that within 7 to 10 business days to the address that you put in your application that's on file, right? So that will come to you for use. What you want to do in terms of activating, because it's a little bit different. Typically you activate a debit card and you call, the debit card phone number or the credit card phone number on the front, and they ask for the last 4 of your social. Our card is actually a little bit different. You'll call the number on the front of the card. It's going to tell you enter your social, but our program actually does not use your social. Our program will actually assign you what we call a fund ID or a U number, because it begins with a U, and it'll have 4 digits at the end of it. What you'll want to do, instead of entering the last 4 of your social, you'll enter the last 4 of your provider specific U number in order to activate the card. And you're probably saying, well, Marche, where do I get this U number? Once we approve you, you'll actually get a welcome letter emailed to you that will have your number noted in there. All right, here's probably the most important thing I can tell you about debit card use. If you're a provider and you're like, I want to use the debit card, it's easy, it's seamless, it's like the most accessible way to access my benefits, I'm here to tell you that you have a responsibility if you swipe the card, right? So really quick, understanding that this program is being funded by the state of California, right? There essentially are some things that come along with that, right? Which, typically is like things like compliance and audit, right? So they the state of California, right, is going to make sure, or want to make sure, that if I give you money to pay for your healthcare costs, that I'm actually checking to make sure that you're actually using these funds for healthcare costs. So what that means is that if you're swiping your card for services or purchases for healthcare, you're gonna have to then upload or email me or mail me a copy of the receipt showing that it was used for an eligible medical expense. And what that looks like is something that shows that you swiped it for a copay, right? Copay lets me know that it's an insurance approved purchase, and it's an eligible expense for you to use these funds for. What I really want to make clear is the request for documentation is not because we want to make the program hard for you, right? It's really that we all have a fiduciary responsibility, myself, and the trustees, and everyone involved, to make sure that we're using the funds for what they are designed for, that we can back that up. And that also, right, we want to make sure that our funding doesn't get cut, and that we can continue to enjoy these benefits for many, many years to come. So what that means is, again, swipe your card, you're going to have to provide me proof of what you spent the money on. So when you get approved for this program, you'll actually also get access to a portal, right, to conduct any of your reimbursement benefit business in. So you'll have a home page that looks very similar to the one that you see on the screen, right? And you'll see over there boxed in is in red, it's the message center. If you swipe your debit card, if I need additional information about your transaction, if your debit card gets suspended, right, because you didn't provide me documentation, if you end up owing me a repayment because you didn't provide me documentation, or something that you swiped the card for is not an eligible expense, right? The only way that I have to communicate that to you is through this message center. So if you swipe in the card, make sure that maybe once a week, once every 2 weeks, you're logging in to check that message center. Because a common thing that happens, everybody, is a provider will, swipe the card, they're using their benefits. They don't realize, or they've forgotten, that they need to provide a receipt for something they spent, they swiped their card for a month ago. By now, I've sent you like 3 messages to that message center saying, hey, send me proof, and then, hey, your debit card is suspended, right? And then, hey, I need you to still send proof. And then they don't see those things. They go out, they swipe their card, it gets denied, right? And then it kind of causes sort of a problem, right? And then you're calling our call center, you're upset, and you're trying to figure out, why is the card not working? So just want to make sure that everyone on this call is aware. If you use your debit card, make sure you're logging in and checking that message center. All right, and then the last 2 things I need to chat with you about, again, since we're talking again about documentation and receipts that need to come in, it's really just making sure that your documentation that comes in is acceptable the first time. A common thing that we get is just a Visa receipt, right? That literally just shows, Visa information and amount, and, that you swiped a card. That's not what I need. What I need is something showing me that what you swiped your card for is an eligible medical expense that's backed by your health insurance plan. Really important for me to say this out loud as well, and I should have said it earlier. This program works with your health plan, not your doctor. They are 2 different entities, and they're not even always friends, right? Your doctor is invested in making sure that you have the best health. Your insurance company is invested in making sure they make money, right? They don't have the same the same thing at the forefront of their mind. So you want to make sure that just because your doctor prescribed something, you do not assume that it's an eligible expense with your health insurance company, which would then mean do not assume it's an eligible expense that this program will pay for, right? So you want to make sure that when you swipe that card, your insurance is paying a portion of the bill. That's the surefire way to make sure that your transactions will be acceptable and you won't have any problems using the healthcare fund. So let's talk about the 4 things that need to be on your documentation when you are submitting what we call receipts for your charges, right? The first thing is typically something with your name on it or something that associates you to the document that's being submitted, right? Can't have your niece's name on it, right? It has to have your name or something that associates the document to you. I need to know what date the services or goods were purchased, right? Very important, because if you got approved for this program January 1st, 2025, I cannot pay for something that happened in 2024, right? So we want to make sure that the charges that we're paying for and the documents that you're submitting, we can see that date of service, right? And then the last two things is I need to see what the monies were paid towards, right? So it's very important to highlight that our team will never ask you for medical diagnosis, right? If you want to share it with us, that's okay too. We'll keep your confidence, but we don't need it in order to process your claims and your transactions, right? But we do need to see things on your documentation like copay, co-insurance, deductible, right? Typically, those are words that insurance carriers use to basically delineate that they're paying a portion and then this is your portion to pay, right? So we need to see on the documentation that your insurance has paid something, or we need to see the language on the document that helps us verify that your insurance paid a portion. And then, of course, the last thing that we need is the amount, right? We need to see the amount that's needed for reimbursement. The last thing I'll leave you with before we maybe try to hit a few questions is an example, right? So it's an example I tell everybody when I do these presentations, which is if you're ever trying to figure out whether or not this program will help you or actually pay for a transaction, remember this story. I had a provider at one of our meetings, and she said, Marche, I'm diabetic. My doctor sent me to a nutritionist. The nutritionist, we went over things to help me, manage my diabetes. And one of it was, changing some of the ways that I eat, right? So the nutritionist made a list, handed it to me and said, you need to go buy these, foods. And she's like, but Marche, healthy food is expensive, right? So I'm wondering, since the doctor sent me to the nutritionist pretty much prescribed me healthy food, right? Apples, oranges, vegetables, and etc. Will this program help me pay for the expensive food that I need in order to manage my diabetes? And I told her, yes, if your health insurance is going to help you pay for part of that apple. So what you want to think about and what you want to remember is that if your health insurance pays a portion, our program will pay the rest. If your health insurance does not pay a portion, unfortunately, this program will not pay the rest. All right. Okay. So I don't know how many questions that we might have in the chat. Let's see if we can get a few of those and I'll try to answer them. And in the meantime, I'm going to put this on the screen. Here's all of our contact information and also MetLife's contact information. So if you have your smartphone, feel free to scan those QR codes. If you have a provider specific situation, right? Something that's about a claim you submitted, something that's about your eligibility, send us an email and we'll have the team follow up after this meeting. All right, so I can't see any of the questions. Anybody?
Marcia, I have a couple that I'm seeing. Yeah, so it looks like life insurance is getting a lot of interest here.
Okay.
But the question is, are they automatically enrolled into life insurance?
The answer to that is yes. So as long as you're enrolled in our program currently, or in the future, it will automatically enroll you in the life insurance once it rolls out. So what that means is today I know who's who's providing the life insurance to our providers. We just haven't finished building it in our systems to show it to you and to get the documents out to you. So what that means is if someone, God forbid, were to pass away today, right? And it's the February the 6th, right? as long as you're in my program effective 1/1, you would have life insurance that your family could actually have access to. So it will be effective retroactively to 1/1/2025. We just have not finished implementing it, so I can't show you anything. I can't send you anything on it. But we're on the heels of that being completed, and I'd say in probably the next 30 to 45 days, information will be in your hands.
Right. Sticking on the life insurance topic, someone is wondering if they already have life insurance, can they also obtain this life insurance?
Absolutely. This does not impact or interfere with anything that you may have. So you'll have two. This one's free of charge. Got it. You can absolutely be double covered, triple covered if you'd like, quadruple if you have other insurance. Yep.
Fantastic. And I think this is a sort of like if you could revisit on the family coverage, how or what a provider would need to do to get their family covered.
Yeah, so again, that's another benefit that's still coming, so not quite built out for all of you yet. But what'll happen is that once we're completed and we're implementing this, providers will have the ability to either contact us to add their family members to their application, or if you're a new provider filling out an application, you'll have the ability to actually add your family members when you're doing an application for this program for yourself. So essentially, and again, we're still hammering out the details, but you'll be able to, like, if you're an existing provider, you'll contact us, let us know, hey, I need to add, my husband or my wife and, my three kids, right? So we'll add them to your application. And then once we hammer out the documentation that you'll need to provide to substantiate that these folks are actually your family members, and not your neighbors, you'll have to then send that documentation into us by either email or mail.
We have another question about how many days back they can be reimbursed.
Is this tied to the family?
I think it's the overall reimbursement program. So what is the period in which I think they probably have to submit receipts?
I see. So the way the program is structured currently is that, and let's talk about 2024 since it just ended. So if you have a charge or a service that was incurred in 2024, we give you until March 31st of the next year, right? So in this case, it'll be March 31st of 2025 to provide us documentation to submit, to clear or get reimbursed for a charge from 2024. So essentially, you have all year plus 3 months every year to actually provide substantiation for charges that happened the year before. That should not, however, be confused with how long you have to submit a receipt or substantiation before your debit card stops working or before I tell you you owe me the money back, right? So you actually have 30 days in our system to actually submit a receipt before your debit card suspends, right? So if you have a charge that you made last year and you still owe a receipt, you want to hurry and send it to us. Also, the third scenario kind of is if you have something you paid out of pocket for, right? You paid your own money at the doctor's and you just never sent in the information so that I could reimburse you. Again, you have until March 31st of this year if it happened last year, right? So as long as you send me, a copy of the receipt or the copy of the document saying, hey, Marche, I spent $150, at a specialist, in October of 2024, you have until March 31st of 2025 to get that to me, and I'll reimburse you the money. What happens is after the 31st of March, the financial, this is probably more than you care to hear, but the financial books close and we can't continue to process payments and move money after the 31st. So you want to make sure that you get it into us before the 31st.
Marche, we're getting a few questions still. I know you addressed it, but it's good to call out getting a few questions. Do I have to register for this life insurance? Do I have to sign up for the new life insurance benefit? So
thank you for calling that out, Lily. You do not. So again, all of let me kind of go backwards in the deck. I knew this would be a hot topic. So any of the benefits that are additional, again, they are literally bundled with the healthcare reimbursement plan. So if you do the application that we talked about at the very beginning, you get approved and you're participating in the healthcare reimbursement fund, all of this stuff except voluntary, right? Voluntary is the only one that you would have to pay out of pocket for if you decide to purchase, but it's not required. All of these other benefits are coming to you free of charge. So that's life insurance. That's a potential retiree health benefit if you get in before essentially the 1st of April. Also, it's EAP benefits, and it's also healthcare reimbursement benefits for your family. All of that comes to you with no additional work needing to be done. You're automatically going to get it, including, of course, dental and vision benefits. I know it sounds too good to be true. One application gets you all of that. Anything else that we might want to address?
There was one about how long it takes for someone to find out if they've been approved.
Yeah, so I'll actually defer to Lily because I know that the team's been powering through all of the new applications that I think we're caught up. So correct me if I'm wrong, Lily, it's usually at least within the week.
yes, thank you so much. Hi, everyone. It usually does take a week. Right now, we still have a few applications that have been coming in quite a bit. So right now it's taking about 10 days. So what happens is when you submit your application, it comes over to our team. It gets assigned to someone as they come. And so as they get approved, or if we need additional information regarding your insurance or any other documentation, we reach out via email. So give it at least 10 days right now, so that we can get to those applications. The team is working very hard every day when they come in. And so they're reaching out to our providers and our applicants as we receive them. So I would say, to reiterate, give us at least 10 days for the time being. There was a point, I'll share with you guys, where we had over 300 applications. So it was taking quite a bit for us to power through and get through them. But we've definitely brought that down now. Currently, this is lifetime. I see about 60 applications. So we're working through those every day. So give the team about 10 days to receive that email. Look out for that in your inbox to the email you applied with.
Awesome. And I see just a couple of questions also about how to kind of get an application or how to apply. So guys, this is our website. I'm just going to show this to everybody really quick. It's ccpuhealth.org, same on your phone, same on your laptop. If you go here, there's a button now here to apply. You can also go up here to log in. Either of those places will actually start you on your journey to the application. And then if you're a provider who prefers a paper application, you can go to resources and forms. Depending on your language, you can select either Chinese, English, or Spanish for your application, and you can download that here. So either way, up to you, right? What you're most comfortable with electronically, which is the fastest, or via paper. You can fill it out, sign it, and then email it back to us. Take a picture and just email it back to us. And the team will actually input it into the system and process it for you. So you have a couple of options in terms of enrolling.
Yes, please submit those applications. We'll be more than happy to get those assigned and worked. And Marche, there's questions still. I know we put a star by covered California. There's a few questions that I see coming in as to what if I cannot get into a silver HMO?
Okay, great question. So all of our providers, okay, So I'm gonna give you a little insider knowledge, right? So obviously, because this is a program, right, funded by the state of California, Covered California is also funded by the state of California, right? It's a state exchange. So what the Covered California team has done is they've partnered with us and our providers, right? So if you are a provider that's currently not on the correct plan, you can actually call Covered California, say, hey, I'm a childcare provider. I need a stipend QLE. And Lily, if you don't mind maybe typing that verbiage into the chat for everybody, if you are in the wrong plan with Covered California, call them and say, hey, I'm a childcare provider. I need a stipend QLE, which is a qualified life event. And that's the key word they need to know in order to understand who you are, and they will actually allow you to change your plan. So they're partnering with us to say, hey, 2 state-funded programs, they understand who you are and what this program is trying to establish. They will allow childcare providers to change their plans. All year round, you don't need like a different qualifying life event, right? Typically, they make you either wait till open enrollment, or they actually say you have to have like a qualifying life event, right? They've actually granted our childcare providers a year-round qualifying life event in order to get into this program. So if you're not in an HMO today, doesn't mean you can't be in one tomorrow, right? You just want to contact Covered California, let them know that verbiage, and they will actually allow you to switch to a silver level HMO. I know we're running over, maybe 1 or 2 more questions. I see a quick question about PPOs. So again, this program does not accept PPOs unless there's no HMO in your area. Again, that's the only caveat. So you just have to make the decision on whether or not you're willing to make the switch in order to get into the program. And the silver level HMO requirement does not apply to other qualified health plan types. It's only if you're a provider enrolled in Covered California. So if you're an employer sponsored or something else, that silver level HMO requirement does not apply. Anything else, Connie or Lily, that you think we need to address for the group?
No, I think we've addressed the questions that were pretty much coming in. Again, for specific case questions, I do see some of those in the chat. Please reach out to us at our customer service or via email. We'll definitely be happy to assist. Our teams are working both queues to help support your questions specifically to your case.
And feel free, if it's an email, to put in there something in the subject that lets us know that you are a participant from today's meeting, and we'll try to answer those first.
Great. And folks are asking, what is the phone number? So if you could just give quickly.
I'll put it back on the chat. I've put it on there. Let me put it back on the bottom.
Okay, yep. And if you're wanting to write it down, folks, it's 833-714-6028. Open Monday through Friday, 8 to 5.
I'll also put the email as well.
All right. Connie, I'm not sure if you want me to turn it back over to you.
No need. Great job. Thank you so much, Marche. Thank you, Lily, for being here. This is really informative. We had, I think, over 180 providers here today. So people are really excited about this and really appreciate all of you for joining today. Have a great rest of the day.